This is a very important question I have received from our dear sister Victoria Aponsa, who wants to know what OSS do. But first of all, I would like to give a brief explanation of what is meant by OSS. OSS, Operatore Socio-Sanitario in Italy. It means social and also health care worker or assistant in English. What does it mean? A brief description of this professional figure. It means somebody who is able to provide care and also assistance to people who are in hardship condition on physical and also mental level in order to meet their primary needs, in order to promote their well-being, their quality of life, their independence, and also their social integration. This is meant by us. This is what we stand for. Some of these things we do are one, what we call the personal hygiene or personal care. When we say personal hygiene stands from supporting patients to take their bath, supporting patients to care for their nails, care for their hair, care for their body, hand washing, also managing incontinence, helping them to change their clothes, also changing of beds and also making of beds, help to manage wounds and also changing of diapers. These are some of the things we do as the personal care or the personal hygiene. It is the most important and also the crucial and the key service of our profession. We do all these things in order to promote the health and also the well-being of the person, to prevent infection and also to promote the dignity of the patient. This is what we call the personal hygiene. Aside that, we do what we call the mobility support. Mobility support means helping patients to move, to walk, and also to change positions. Sometimes we do all these things independently or in collaboration with the physiotherapists and also other social workers. We also do what we call the basic health monitoring. The basic health monitoring starts for checking the vital signs of the patient. Some of these vital signs are the pressure, we check the pulse, we check the temperatures, and also other vital signs needed to be checked. Sometimes we do these things on indication of the nursing staff, or the OSS can do all these things independently on their own. Furthermore, we do what we call the medical assistance. What is medical assistance? Medical assistance means ensuring that patients takes their prescribed medication as it is being prescribed by the doctor or the nurse. We sometimes do all these things by providing them with the necessary things needed to take their medications, like maybe water or juice or any other things that has been prescribed for you to use or to help the patients take their medication. This is what we call the medical assistance. We have many aspects of this, but I am just briefing everything in order not to make this video very long. As an OSS, depending on the area where you do your work, we also do something we call the environmental support. The moment you are in the space of a patient, you need to maintain cleanliness and also sanitation. So if you are in a room or in the house of a patient or a place whereby the patient is being kept, you need to maintain cleanliness and also sanitation. If the room is being disorganized, things are being misplaced, you need to make sure the room is clean and also the room is well organized to avoid any further fall or any further injuries. We also do what we call the meal assistance. During mealtime, we help patients to sit at the table. We arrange food on the table or on the tray for patients. As an OSS, you know the various types of pathologies and also their diet. So whenever a meal is being prepared and served to the patient, you need to control to know whether it is the right meal that has been prepared or set for the right patient. Sometimes when a patient is unable to eat on their own, we need to spoon feed some of them, and after eating we need to do what we call the oral hygiene or clean some of their. Okay, moving on. As an OSS, you need to provide emotional and also social support to patients. All these things are done through communication. We foster on communication, reassurance, showing empathy, also listening attentively to patients, their needs, and also to help them emotionally. So sometimes these things are done depending on the sector or the area where you do your work or the condition of the patient. Sometimes too, we do these things by bringing in activities, social activities that will help the patients to integrate and also communicate. We have something we call the attività occupazionale, which means occupational activities. Patients are being put in groups to help them to communicate among themselves, to help them to do some activities like cooking, activities like watering the plant, activities like playing of cards, listening to music, and also watching TV or listening to radio together. Some of these activities help the patient to socialize. It helps them to communicate. It prevents them from being isolated. It also helps to give them a sense of belonging, okay? Because if they are in a group, they tend to have companionship with other people and also with the social and the health care worker. So as an OSS, we work collaboratively with other health professionals like the nurses, the doctors, the physiotherapists, and also other social workers to provide comprehensive care for patients. Also, we are the key figure in addressing situations or cases or needs of the patients to the nurses and also the doctors in order to help them to provide a more complex medical interventions for patients. So as you see, as an OSS, we play a very important role in the health and also the social sector. If you are watching me today and you would like to embark on the journey to become an OSS, you don't know where to start from, this is the right channel for you. On this channel, I do explain some of the things you needed to become an OSS. You can drop down your questions and any other thing you needed to know, and I'll come back to you with my answers. Thank you all, and thank you for watching. Bye.